This project began as an exploration into what nursing is at its essence. What is nursing practice, and what does it mean to be a nurse? Being first-year nursing students, to gain perspective on this topic, we looked to the experts, nursing leaders in both research and in practice. This video is therefore the final depiction of what our nursing philosophy is and how it was manifested. The purpose of nursing practice is to provide safe, ethical, competent, and compassionate care to individuals, families, and communities. The purpose of nursing is theory-based, holistic in nature, and focuses on clients' strengths, needs, and goals to ensure clients receive the care they require. The purpose of nursing is also to use clinical judgment and critical thinking during nursing practice to ensure that the care the client receives follows the guidelines and the scope of practice set out by the regulatory bodies. The purpose of nursing also goes beyond the traditional role of a nurse as a caregiver and recognizes the many roles nurses have, including decision maker, leader, and coordinators of care. In order to attain a good understanding of what the scope of practice is for nurses, we look to the nurses themselves as well as their regulatory bodies. The College of Nurses of Ontario asserts that the practice of nursing is the promotion of health and the assessment of, the provision of, the care of, and the treatment of health conditions by supportive, preventative, therapeutic, palliative, and rehabilitative means in order to attain or maintain optimal function.
We provided total patient care. This included physical and emotional support and care, the ongoing assessments of our patient and their status, consulting with other healthcare professionals on the team, assisting with discharge planning, communicating with the patient's family and significant others. We worked as a team together.
The difference here, maybe we should point out, between small towns and cities is like, you guys can call an IV team, you guys can call respirology. We can't. We have to do it all ourselves. We do have a respirologist now, and she comes down, she'll set up our vent for us, but that's Monday to Friday, 8 to 4. So we used to do all the scopes and emerge, but we don't do any of that anymore. Still some paracentesis and thoracentesis if people present in an emergency situation where they can't breathe or they're, then we'll do it as an emergency, but we don't do booked procedures anymore in the emergency because it's just gotten so busy. So we do TNK for MIs, we do TPA for strokes, we do it all, every bit of it.
After looking into the basics of what nursing is, we dove further into the theory, exploring concepts of art and science in nursing practice. We found that successful nursing must include the smooth and balanced integration of both art and science. The science aspect of nursing consists of the nurse understanding their responsibility to have knowledge and skills in critical thinking, clinical decision-making, and evidence-based practice, upholding clinical competency and staying current with the science advancements within the nursing field. The art of nursing concerns qualities such as caring and compassion and good communication that are essential for providing effective patient-centered care. The art of nursing is shown in unique ways in each unique nurse as they provide competent care to their patients.
Well, I think they definitely need to be a caring person and very empathetic as well. Also very knowledgeable about different aspects of care that they need to do for patients, and able to stand up for themselves in the face of superior people that would be putting them down.
By understanding what attributes make up the skills and character of a nurse, we then explored how the nurse then relates to their patients via the nurse-client relationship. The therapeutic nurse-client relationship is crucial to any effective nursing practice. It is a unique relationship because it has a purpose. It is goal-oriented, and its process revolves around the patient's best interests and outcome. The therapeutic relationship generates professional responsibility as well as moral obligations. These responsibilities encompass trust, power, empathy, respect, and professional intimacy. This nurse-client relationship can be fostered anywhere within the nursing meta-paradigm, including environment, nursing, person, health, or even through the more recent addition of social justice. Social justice is a core nursing value that involves equal distribution of resources within society. Nurses play a pivotal role in the advocacy of social justice for patients, family, and communities. Nurses therefore must ensure that social justice remains the foundation of their practice to provide equitable health care for society.
I think a lot of patients, when they come in, you basically leave your dignity at the door. A lot of things happen inside of a hospital that people really don't have a whole lot of control over. So I think allowing people to have choices in what happens in their care, having them involved in decision making, and like I say, just keeping them informed as to what's going on and what they can expect during their stay, I think is really important.
The impact of the nursing profession can be felt around the world. Nursing is a universal profession that has the power to affect patient outcomes globally. Nurses can impact patients through research, safety, and the development of nursing services around the world. The personal, empathetic nursing care that nurses provide builds trust between the nurse and the client and allows for greater personal healing. It is estimated that nurses care for 9 out of every 10 patients seen, and nurses in lower, middle, and more affluent countries prevent infections in various settings and impact health globally in the small acts they do to improve patient care. This project allowed us to explore nursing through both literature and nurses themselves. Our philosophy of nursing was created through the interaction with these nurses and the knowledge we gained throughout our first year as nursing students. Our nursing philosophy is as follows. Nursing encompasses the seamless use of both art and science to care for clients in both hospital and community settings. A holistic approach to care is integral to the facilitation of a curative result for the client. The nurse is a partner to the client as they use their knowledge to aid in the client's journey towards health, while also striving to advocate for the client's autonomy over their decisions. Nurses may take many forms, do many different tasks, and wear many different hats. But one thing will always hold true.
You can retire. You can go to Timbuktu. You can do whatever you want to do. You will always be a nurse.